Hello dear friends, again very warm welcome to all of you at our conceptual brainstorming integrated session of the anatomy. So right now we are starting our head neck face region, in which our first topic is scalp. Yes, in a funny way, what is the scalp? Area in our cranial region where we apply shampoo is known as scalp. Can you see this skull image? Yes. So this upper part is scalp. We will see. After this scalp, we will read about the face in funny way. What is the face? Where we apply face wash, that is the face. Okay, and then we will study about the our neck. What is the neck? So this below part, okay, from the face down up to the thorax, that is the neck. Just I told you in a wide way, we are going to look in a very appropriate way. And remember, this head neck face portion, it is very complicated and very important, because here our brain stem and the different cranial nerves, these all are located, which are controlling all over the activity of the body and different organs. So get ready for the core of the anatomy, very important. Okay, so we are starting from our scalp topic. So first of all, whenever it is going to ask, you have to know what is the scalp. So heading by heading, yes, step by step, what is the our scalp? So try to understand definition. It is soft tissue covering. First point, it is soft tissue covering where, remember, over cranial vault. So this is the cranial vault over which the soft tissue covering is located. Hold this one, try to hold this one. Here the soft tissue covering over the cranium, that is known as our scalp. Okay, known as scalp. Fine. Now try to understand the extension. Sir, this is our cranial region from where the scalp is starting and where it is ending. So just look for the our extent. So if you are the student for the theory exam, then heading by heading, step by step, this all the descriptions are important, so you can observe the diagrammatic presentation and our dissection steps. Yes. So just observe here. Okay, in head neck face region we are doing the dissection. So what are the our different incision layer? See here, at the midline we are giving our first incision, which is extending above, and then it is going to the back side. So this is our first incision with the help of the scalpel. Okay, from the nose midline we have to cut in this way, and then at the center just above the pinna we have to cut on each side. So this is the third incision. Over the ear you have to move the scalpel, so you will look our, yes, fourth incision, which you have to extend forward, fifth incision. Okay, and then another incision from the chin at the center, then encircle the mouth region, and then from our ala of the nose reach to the our first site of the incision. Fine, and then you have to make the incision on the lateral side. So this is the our dissection, and then open flap layer by layer. So the scalp, yes, here 1, 2, and in the same way opposite side the 4 flaps will be open, and you have to go layer by layer dissection. Getting the point? Okay, so just observe this diagrammatic presentation. Scalp is starting from our supraorbital margin, okay, here near the eyebrow, okay, and on the posterior side, this scalp where the hair follicles are grown, they are up to the external occipital protuberance. Do you remember in our trapezius part we studied that on the back side, see here the 3-dimensional anatomy. So on the back side of the our skull, yes, this is the our skull, rotating this one, and when you are reaching on the back side, can you see this bony prominence? This is our external occipital protuberance, and the lines are going here, that is superior nuchal line. In trapezius we had already observed. So on the posterior side there is the external occipital protuberance and superior nuchal line, this is the extent. And then on each side, when you will observe on the temporal bone, remember the bone on the temple region, on the each side, that is the temporal region, okay, temporal bone. On the front region, frontal bone. On the back region, definitely our occipital bone, you all know since your school time, okay. So here on each side there is the one line known as superior temporal line. So this entire area is our scalp. Remember, this is a scalp. This area is a scalp. Again in funny way, the area where the hair follicles grow, that is the scalp. Getting the point? Okay. Now further see here, we are going to look for the our extent. Okay. So where, how you can describe the extension? You can describe the extent anterior, posterior, and right and left, means lateral side. So what you can say, anterior extent, posterior extent, and then on each side. Anterior extent, what you have to say? Anteriorly it is extending up to the our supraorbital margin, margin just above the our orbit, okay. Posterior, you know, our external occipital protuberance, and another one is superior nuchal line, simple. And then on each side, what you will say? Our superior temporal line, superior temporal line. Getting the point? So these are the our 3 points. Yes, here we describe the extent, anterior, posterior, and on each side. Fine. Now what are the points in a very interesting and funny way which you can recall? That scalp, it is our magic of 5. It is, yes, magic of 5. How can you remember scalp as the magic of 5? What is the magic of 5? It is having, yes, I am writing in this way, 5 layers for which we will learn the our mnemonic SCALP. S for skin, C for connective tissue, A for aponeurotic layer, L for loose areolar tissue, and P for pericranium. Fine. Another, we will learn about the 5 arteries and veins. So total 5 arteries are supplying the our scalp and 5 veins are draining. Then third, we will learn about the 5 nerves in front of ear and 5 nerves back of auricle, ear or pinna. So 5 nerves we will study in front and 5 nerves behind the ear, and after this all we will learn about our 5 applied. Okay, so in this way this point you can remember as magic of 5. This is the our short trick. Getting the point? Okay, so what we are going to learn: 5 layers, 5 arteries, 5 nerves in front of the ear, 5 nerves back of the ear, or you can say behind the ear, and 5 applied. So total 5 points, 1 2 3 4 5 you can say. That's why we are saying it is magic of 5. Okay, so one by one, what are the our different 5 layers? Can you observe here? Yes, you are doing dissection and then you are enlarging, you are observing. Can you see here is the brain? Yes sir, this is our brain tissue. You can observe the gray matter and the white matter, sulci and the gyri. It is covered with the pia matter, our arachnoid matter and dura matter. Don't worry, we will read later. Yes, here is our dura matter, arachnoid matter and pia matter. We will read in our brain part. Okay, but when you are looking outside, you can observe there is skin of a scalp, there is periosteum and bone of a skull. So different our layers are located. Getting the point? You can observe our textbook also, where the diagrammatic presentation of scalp is done. See here, we are going to make easier this diagram. Yes, yes, just give me a few minutes. We are going to look for the our scalp diagram which is given in your textbook. So you can see here. Yes, see here, skin with hair, this is our S, and then next layer is connective tissue, that is our C. Next another layer is aponeurotic layer, A. Loose connective tissue layer, L, and the last one is our pericranium. Getting the point? Okay, so now try to understand, these are the different layers. We are going to make easier this diagram. So just observe properly, layer by layer we are going to draw the diagrammatic presentation. So first layer is skin. We are going to do our linear presentation, so make a diagrammatic presentation with the proper color. Suppose we are doing dissection, so first most layer is skin. Yes, suppose this is our layer of the skin. As you know, one thing you have to remember, skin is having rich in supply of the hair follicle. So this is the diagrammatic presentation of the hair follicle. One clinical point, that at the root of the hair follicle there is the opening of the our sebaceous duct. If these sebaceous ducts they are getting blocked, then collection of the sebum occurs at the root of the hair follicle, that is known as the folliculitis. Also you can say yes, boils, we will see. Okay, but this you have to remember, this is our first layer, skin, and then there is the layer of the connective tissue, C. So diagrammatic presentation, this is our second layer, connective tissue. Then aponeurotic layer is there, that is A. So this is our aponeurotic layer. Fine. Again labeling for all of you. So here you can observe skin. Yes, remember these is with hair. Fine. And then next layer is our connective tissue. Okay. Then another one more layer, that is aponeurotic layer. Here is our aponeurotic layer, also known as Gallia aponeurotica. So you can observe SCA. Then another one more layer is there, that is loose areolar tissue layer. It is loosely arranged. Yes, this layer is loosely arranged. So loose areolar layer, what we are saying, this is our loose areolar layer. Okay, and then innermost layer is our pericranium, which is firmly attached to the our cranial bone. So here is our pericranium. Okay, so you can observe, suppose this is our skull bone. Fine. So you can observe the layer of the connective tissue, fibrous collagen, this all, which is covering our cranial bone and also continuing along with the suture to the inner side. As I told you during the general anatomy, during the suture topic, yes, our skull bones, these are example of flat bone. MCQ integrating with your general anatomy. Yes, and there are the different kind of our sutures. And skull bone is very characteristic presentation. It is having the very characteristic presentation. It is thick bone. It is having the two layers, outer layer and inner layer. Better to say outer table and inner table. And it is the classical site for the extramedullary hematopoiesis. So here is the our synthesis of the RBC also. So few very nice concept we are going to learn step by step. Okay, what I want to tell you right now, yes, SCAL, and this is the our fifth layer known as pericranium. So hope you can easily capture this trick. Yes, see here the beauty of the anatomy. Okay, what are the 5 layers of the scalp? Your trick is definitely SCALP. So these are our 5 layers of scalp, and it is not my trick. It is the trick. It is the mnemonic given in your textbook. Okay, so make the textbook your friends. Books are the best friend in our life. Okay, they are giving so many knowledge. Now what I want to tell you, I had shown you the cranial bone. So here is our outer table, here is our inner table. Okay, and in between them you can see our extra medullary hematopoiesis. Physiology, the cranial bone is the classical example of the flat bone, and also the innermost layer is our, yes, endosteum. Okay, getting the point? So there is a pericranium, What is the periosteum? We will see this all the points one by one, layer by layer. Okay, fine. So this is our endosteum or endosteal layer of the dura mater. We will see. Fine. So this is the one our easy presentation, but little more detail. So in more detailed way, fine. So look here, first layer, definitely that is skin with hairs. What the clinical you have to remember, infection of the hair root, that is known as the our sebaceous cyst. So we will look our clinical point, sebaceous cyst. Fine. Then here is our connective tissue layer. Remember, skin, superficial fascia, deep fascia, it is nothing, it is our superficial fascia. You can say yes, this is superficial fascia. You know, always the superficial fascia is having cutaneous nerve and vessels. So what you can observe here, there are our different neurovascular bundle which are having our cutaneous arteries, diagrammatic presentation, cutaneous veins, and our cutaneous nerves. Getting the point? Yes, these all are enclosed within the our sheath. So these are neurovascular bundle, you can say superficial. Okay, so these are nothing, these are cutaneous nerve and vessels. Okay, we will observe in detail about this all. So these are our cutaneous nerve and vessels. Getting the point? Now try to understand. Here is our next layer, aponeurosis layer, also you can say Gallia aponeurotica. In our upcoming classes I will tell you this Gallia aponeurotica, in front it is having the one muscle which is known as frontalis. I am showing you in the three-dimensional presentation way, so you can observe here. Can you see the flat tendon over the our cranium? This is our Gallia aponeurotica. On the front it is having the muscle on the front, that's why what you want to say frontalis, and on the back side, yes, can you observe the small muscle on the back side? This is over the occipital region, that's why occipitalis. So only two MCQs you have to remember. Gallia aponeurotica, it is related with our two muscles. Yes, in the front there is frontalis, on the back, yes, it is having the occipitalis. Getting the point? Okay, and then you can observe the loose areolar tissue layer. It is considered as dangerous area of the scalp. Why? We will observe. Fine. What the other point you have to remember? This is our, yes, this is our loose areolar layer. Again mentioning here, loose areolar layer. and here you can observe pericranium. Okay, so these are our different layers. What you can remember? S, C, A, L, P. Now more points. See here, inside you will observe there is our brain. Brain is having, yes, sulci, gyri. Just one diagrammatic presentation. Okay sir, suppose this is the brain. Fine. You know, the brain is covered by the different layers of the meninges. The outermost layer is dura mater. So I am showing you the dura mater layer. Dura mater is again divided into the two layers. One layer is firmly attached to the other layer of the meninges, that is a meningeal layer. Okay, or in a better way, yes, fine. So these are the two layers of the dura mater, and in upcoming classes I will teach you within this fold of the dura mater there is the vein. One large vein of the brain is located, that is superior sagittal sinus, sinuses of the brain. Fine. What I want to tell you, this is complete our layer of the dura mater. Okay sir, agree, this is the layer of our dura mater, which is actually having the two layers. For the MCQ purpose you have to remember, yes, what are the different two layers I am showing here. Here is our brain. Fine sir, you can see endosteal layer, and another one is inside, that's why you can say meningeal layer. So these are our two layers. Of dura mater. Okay, and in between them there is the one venous cavity is located. This is our sinus of the brain. Okay, so this is within the dura mater, that's why you will say dural. It is the cavity in which venous blood is filled, that's why dural. Venous, large cavity, that's why you will say sinus. So it is dural venous sinus. Now one very interesting fact, can you observe these cutaneous vessels are outside the brain, that's why extracranial vein. Yes sir, these veins are inside the brain, that's why intracranial vein. Fine sir. So there are the certain special kind of the veins are located which are joining the extracranial vein and the intracranial vein. These are known as emissary vein. Very important question. Yes, very high yielding points and different MCQs are asked. Okay, so here you can observe our emissary vein, and later I will teach you one more venous channel are there which are joining this our extramedullary hematopoietic site, bone marrow site, to the our, yes, these dural venous sinuses, these are diploic vein. Getting the point? Okay, so what I taught you right now, two important facts. Yes, these are emissary veins which joins the extracranial vein and the intracranial vein, while here we observe our diploic veins which are connecting our sinuses vein with the extramedullary hematopoiesis site. Okay, what is the function of the emissary vein? Yes, they are connected with our intracranial sinuses, so they will help in maintenance of the pressure inside the brain, CSF pressure, these all the points. While this diploic vein, yes, they will carry the RBCs which are synthesized here, you know, bone marrow. Yes, it is the bone marrow, flat bone marrow. So RBCs are formed here, then they will drain through here into the our different sinuses, and then it will continue in our main circulation. Okay, so this is the diagrammatic presentation for all the layers. Fine, step by step we are moving for the next. Now there are the few diagrammatic presentation more. You can see this is our coronal section. So what are our different layers of the scalp? SCALP, scalp, skin, then superficial fascia, then our aponeurosis layer, then our gallia aponeurotica, and then last one is our inside the brain, that will be pericranium. Leave right now the temporalis and the other structure. Fine. So after this all, we are going to look for the 5 arteries of the scalp. Okay, so now we are going to look for the our 5 arteries of the scalp. Magic of 5, we observe the 5 layers. Yes sir, this was our first title, 5 layers of what? Scalp. Now we are going to focus for the 5 arteries. Five arteries as well as 5 veins. Okay, so going to make a diagrammatic presentation for all of you. Yes, you can observe the diagram from your textbook also. So look for the diagram. Yes, so here this is the diagrammatic presentation. We are going to draw this diagram. This is the very beautiful diagram which is presenting all the arteries and the nerves. Five arteries of the scalp. Yes. So you are looking the scalp region from the above. So you can see here the nose, here you can see the occipital region, and on each side ear. So can you observe what are the 5 arteries? 1, 2, 3, 4, 5. Okay, you can observe the supratrochlear artery, supraorbital artery, superficial temporal, posterior auricular, and occipital. So we are going to make easier this diagram. Yes, how can you draw, how can you present? See here. So first draw the oval shaped our scalp. You are looking the scalp from the above. So here is the nose, anterior side, and on each side you can draw the ear. Suppose these are our ears. Fine. So you can show anterior, here you can show posterior. So try to understand, just near the orbit one artery will go upside and it is supplying the scalp. Okay, so there is one trochlear notch near the orbit, that's why it is our supratrochlear artery, and just above the orbit there will be the our supraorbital artery. Fine. See here with the three-dimensional orientation, can you observe this artery supply? So observe here this particular branch. Okay, here is the one trochlear structure, from here the artery is coming, supratrochlear artery, and this is another artery. Can you observe here? Here you will see supraorbital foramen. So one artery is coming from here, supraorbital artery. Okay, so we are going to indicate the same arteries here. These are our supratrochlear artery. Fine, sir, no problem. And then another artery is near the orbit, that's why supraorbital artery. Getting the point? Another artery is from our temporal region, that's why what you will say, this is our superficial temporal artery. So here is our superficial temporal artery. Another artery is running from back side of the ear. So what you will say, this is our posterior auricular artery. Okay, and another artery is coming from the back side of the scalp with the zigzag manner. So it is at our occipital region. So what you will say, this is occipital artery. Yes sir, this is our occipital artery. Getting the point? So these are our 5 arteries, 1, 2, 3, 4, 5. Very easy. Now MCQs. See here, what are our different MCQs which are asked? Yes, see here, this supratrochlear and supraorbital artery, these are branch from the MCQ. Ophthalmic artery, and this ophthalmic artery is branch from internal carotid artery, MCQ. Fine. While later I will teach you, these 3 arteries are branch from external carotid artery. So this scalp is the site where this all the arteries are making anastomosis. Scalp is very vascular. जब भी हम बाइक में जा रहे हैं सवारी करके, पुलिसमैन अक्सर कहते हैं हेलमेट पहनो. Why? Because if there is an injury in the scalp, there is the profuse bleeding. So correlate that our point with anatomy. Okay, what I want to tell you, our scalp is supplied by rich anastomotic area which is formed by internal and external carotid artery. So what I want to tell you, the scalp is classical site for anastomosis between external carotid artery and internal carotid artery. So this is the point which you can remember. Fine. Okay. So different MCQs we had seen, and in the same way veins are also similar. Remember, veins always follow the artery. So there will be our supratrochlear vein, supraorbital vein, superficial temporal vein, posterior auricular vein, and our occipital vein. Getting the point? Yes. After this all, we are going to talk about our 5 nerves in front of the ear, then 5 nerves behind the ear. Yes, we are looking for the our five nerves. Yes, in front of ear, and then we will talk 5 nerves behind the ear. Okay, or in the same image we are drawing 5 nerves behind ear. Yes, this is our third and fourth. So both the diagram we are merging in the same. Okay, so try to understand again. Suppose this is our scalp. Fine. And then here is our nose, and on each side there are the ear. So what are the nerves in front of the ear? Simple. Yes, supratrochlear nerve, same like the artery and the vein. Supraorbital nerve. Okay, sir. And then here is our zygomatic bone. From the zygomatic bone, the nerve is running towards the temporal region. So what should be the name? Zygomatico temporal nerve. From the auricular region, the nerve is running towards the temporal side. That's why auricular temporal nerve. So here is zygomatico temporal, and here is our auricular temporal nerve. Getting the point? So these are the 4 nerves which are sensory. These are responsible for the sensation. Yes, when you touch the scalp, they carry the sensation, touch sensation, these all the things. Fine. So what are our different nomenclature? See here. These are our supratrochlear nerve. Fine, sir. Another is our supraorbital nerve. Okay, sir. And then next one is our zygomatico. Yes. Temporal nerve. And another one is auricular temporal nerve. Getting the point? Yes. In short, we will say ZTN, ATN. Fine. These 4 nerves are sensory in nature. These 4 nerves are sensory nerves, and one nerve is motor. Remember, later I will teach you the face is supplied by the facial nerve. Facial nerve is the motor nerve, which is having the 5 division: temporal division, then zygomatic division, then our buccal division, then marginal mandibular, and then cervical. 5. So scalp is having this particular division. Don't worry, later I will teach you. This is our, yes, temporal branch of facial nerve, because it is at the temporal region. So what you will say? There is one another nerve. This is, yes, temporal branch of what? Facial nerve. It is, yes, here are 4 sensory nerve and here is 1 motor nerve. Fine. Yes, 4 sensory and 1 motor nerve. Okay, where definitely in front of ear. Okay, and now what are the different nerves behind the ear? So behind the ear, this is the occipital region, so definitely you will say occipital nerve. This is the ear, also you can say auricle. So behind the auricle the nerve is present, that is our posterior auricular nerve. So what are our different nerves? See here, our occipital nerve, one nerve is very long, that's why you will say great occipital nerve. Another nerve is small, that's why less occipital nerve, or better to say lesser occipital nerve. And one more occipital nerve is there, that's why you will say third occipital nerve. Third occipital. Fine. What I want to tell you, yes, in the occipital region there are the occipital nerve. So this is small, so you will say laser occipital nerve. Another nerve is long, that's why you will say greater occipital nerve. And another nerve is third in number, that's why simply you will say third occipital nerve, simply. Okay, now one nerve is there which is supplying the major part of the auricle, that's why you will say yes, great auricular nerve. So this is our great auricular nerve. Yes sir, this is our great, also you can say greater on the behind. Okay, so great auricular nerve. Later I will teach you, it is actually the posterior division. These 4 are definitely our 4 sensory nerves and there is a 1 motor nerve, and that motor nerve again facial nerve, because our trick is facial nerve is the motor nerve of the face. Getting the point? So here is the 1 motor nerve, that is again branch from our facial nerve. So what I want to tell you, this is our facial nerve, which branch? Behind the ear, that's why better to say posterior auricular branch. Again remember, it is motor nerve. Fine. So try to catch this point. Yes, here is the ear. Okay sir, we had seen the 5 nerves in front of the ear. Yes, 5 nerves. This is the ear. In front of the ear where the 4 sensory and 1 motor, and behind the ear again 4 sensory and 1 motor. Okay, so these are our 5 nerves behind ear. Definitely among these 4 sensory and 1 motor and 5 nerves in front of the ear, 4 sensory and 1 motor. Getting the point? So you have to make practice for it. See here, read the anatomy in your own body. Hold the ear. Okay, sir. In front of the ear, here is the trochlear region, supratrochlear. Here is the orbital region. So supraorbital, supratrochlear, supraorbital. This is a zygomatic bone to the temporal regions, temporal region. So zygomatic or temporal nerve. Then here is our auricular region and the temporal region. So auricular temporal nerve. Fine. 4 sensory nerve. And in front our facial nerve. Which branch? Temporal branch. Behind the ear, what you can say, the nerve which is supplying the auricle, great auricular nerve, then lesser occipital nerve, greater occipital nerve, and the third occipital nerve. Which is motor? Facial nerve is motor. Which branch of the facial nerve? Which is supplying behind the ear. So what you will say? Posterior auricular branch. Complete. Okay. So these are our 5 nerves supplying behind the ear. Okay. Venous drainage I will teach you in our face part. Fine. And yes, this is the venous drainage diagram we will see in our face part. So these are the different points. Now the different clinical points we will discuss in our next class. So right now we are starting our live doubt discussion session. Thank you very much. God bless you all. Any doubt you can ask. Thank you.